Hey, my name's Christine, and this is going to be a response to the TED Talk given by Nora Bloom called The Mental Health System, A Call for Change. Okay, so first and foremost, I want to say that I think the topic that she is talking about, mental illness and the mental health system in today's society, is something that needs to be addressed more clearly, and for that reason I applaud her in being so bold to talk about it. There was a lot of truth that she spoke about in regards to the stigma that is associated with mental illness and how it isn't being treated properly. I think the statistics that she wove into her talk, for example, the statistics about suicides and literally kids under the age of 18 planning out their own deaths is truly horrifying and is evidence of the fact that it's not being treated properly. Even more so, I think this talk was very beneficial because she didn't only address the problems, but she also gave a solution. Not only has she created her own platform called SW290, but she's also drawing attention to the fact that there needs to be policy changes within the provisions of healthcare. The fact that healthcare providers are not covering mental illnesses financially is also evidence that that mental illnesses are not looked at or valued the same as other illnesses or injuries. So while I give her a lot of credit for her presentation and all that she's done to address the problem, I also kind of think that parts of her talk didn't quite capture the complexity of mental illnesses. I didn't love her comparison of her friend's mental pain to a toothache, mainly because by nature, tangible issues or problems or injuries like toothaches are a lot easier to treat, and Western medicine knows exactly how to treat them, whereas mental illnesses, there's not an exact developed science about how to treat them. In fairness to her, she did touch on the fact that some mental illnesses have physical symptoms that doctors can see, such as seeing on brain scans areas of actual depression, but if that's her argument, then she should really only be talking about depression or anxiety rather than encompassing the whole into the category of mental illness, because there are a lot of mental illnesses that you can't diagnose physically. I also want to say that as somebody who has experienced bouts of depression and anxiety in my life, as well as I'm very close with some people that have experienced it way worse than I have, I know that it's something that's not easy to talk about or bring to the surface to close friends or family or people that you trust, let alone strangers, like how therapy is offered. But as a whole, I just think that mental illnesses, I don't think there's any sort of clear solution to the problem. And unfortunately, much of her talk did kind of bash the efforts that have been made up until this point. And then kind of going off that, I also don't think that she properly took the perspective of how has this issue been addressed in the course of history, because if you look at how mental illnesses were seen just about a century ago, people were seen as insane or inhuman because they experienced these mental illnesses, and for that reason they would just throw them into mental asylums and hospitals, and the care for it then was far worse than it is now. So I think in that perspective there has been a lot of progress made here in America as well as the world. But with all that being said, I'm definitely not the expert in this topic. Her credentials far outweigh mine do. And I really don't mean to discredit what she's done, because I really do think SW290 is an awesome platform that has created an avenue for people that don't feel like they can go and get help on their own. And there's obviously a need for that. And I just really do love how she's called attention to what healthcare looks like and how they have chosen to cover mental illnesses. So in that sense, I think this was a really, really awesome talk.